My name is Jeremy Olson Ehlert. I'm a registered nurse at Hennepin County Medical Center, and I'm the second vice president of the Minnesota Nurses Association. Over 1,700 of my fellow MNA members call HCMC their workplace. I'm here to testify in support of House File 4841, but more importantly, in support of a sustainable solution to fund Hennepin County Medical Center. Committee members, I want to start with something just simple. HCMC is not just a level 1 adult and pediatric trauma center. It's where Minnesotans go when everything else has failed. When a patient is uninsured, when they are in crisis, when no other system will catch them, HCMC is the safety net. As nurses, we don't just talk about this in theory, we see it. We see the patient who had to wait because they had nowhere else to go. We see the transfer that comes in because the case is too complex, too costly, or too hard. We see what happens when the system turns patients away. If HCMC is shuttered, patients will wait significantly longer in emergency rooms across the metro, and hospitals in greater Minnesota will lose the partner that they rely on to take cases that they can't. Let's be real, there is no backup plan for any of these patients. There is no extra capacity, not in the metro and not anywhere else in Minnesota. HCMC is Minnesota's safety net. We are grateful for the careful attention to this issue by Representative Agbaje and Rep. Nadeau, Chair Gomez and Chair Davids, and your commitment to something sustainable. You can add M&A to the long list of groups who do not want to be back here again next year having the same conversation about a long-term solution simply because one-time funding was easier to get done. Kicking the can down the road creates immense uncertainty, and for a hospital that already pays its bedside nurses less than in private hospitals, one-time funding will not provide workers much certainty or confidence, which will undoubtedly have a significant impact on worker retention and recruitment. We hope that you will all include workers in the discussions as the language of the bill ultimately takes shape. My union has been particularly involved in discussions here at the legislature for a long time, not just about funding, but also about hospital governance. And our members care a lot about what happens to the hospital that we love. Rep. Agbaje, Nadeau, thank you for all your hard work on this bill, and thank you again, Co-Chair Davids and Gomez, for the work on this issue. And thank you again, Madam Chair, which I also mean as thanks for introducing House File 4849 this week as well, which M&A also supports. I'd be happy to answer any questions.
Thank you very much.